Mineshaitanirrajim. Bismillahirrahmanirrahim. CME update by Mother and Child Survival Group of Pakistan. Topic is smoking in pregnancy. It's a smoking in pregnancy is a very hazardous one and leads to a booking of an high risk pregnancy. Because there are problems and risk and complications associated with this smoking, especially in pregnancy. One is there is miscarriages, there is preterm rupture of the membranes, there is increased chances of infections, there is preterm labor and others also. And also with the smoking there is chances of increased placental abruption and increase in the incidence of placenta previa 2-3 times, especially for the placenta previa. Also there are other risk factors are also there is increased chances of hypertension pregnancy, especially the pregnancy induced hypertension, preeclampsia and eclampsia, and this then leads to a complex series of issues which need to be addressed, especially with this smoking. And there should be a motivating group or group specific TOS therapies to be applied for at least cessation or complete cessation or at least reduction of the smoking. There is increased incidence of intrauterine growth retardation, IUGR, and there is also decreased amniotic fluid, and which leads to other malposition malpresentations, and then there is also increase births of low birth weight babies because of these smoking hazards. The other cardiovascular effects of the smoking in the normal women are increase in the level of the cholesterol, triglyceride, and all fractions of the LDL, HDL, and lipids and triglycerides, and which leads to increase in the hypertension, increase in diabetes, increase in micro and macrovascular complications, and especially the ischemic heart disease and the cerebrovascular accidents. These are all related, and these can also be due to in the pregnancy as well, because the basic pathology is the same. And then with the pregnancy there is so it becomes a very high risk pregnancy, and since it leads to the growth restriction and placental insufficiency, and later to the decrease in the amniotic fluid, and then all other labor related complications, miscarriages, preterm labor, preterm rupture of membranes, and premature rupture of membrane, and prematurity. So all these things to be considered. And there is sudden intrauterine death as well, and there is early neonatal deaths as well. And then there are effects on the growth of the neonatal children later on in their life, which also be briefly reviewed. So it's a high risk pregnancy to be monitored serially with the ultrasound growth scan, serial scans, and with the all the parameters, especially in the last trimesters, when there is increased incidence in the pregnancy-induced hypertension and others, and low birth weight babies and IUGRs. and has to follow and serial growth scans, ultrasound scans, and especially the Doppler one, umbilical artery Doppler and cerebral artery Doppler, and all these has to be and has to follow that when there is a reverse flow of the blood. Uh, so with these there are other hazards effects of as well, increased incidence of the infections, preterm labor, premature rupture of membranes, and prematurity. So for this, what we have to do in order to reduce these complications, we have to motivate the mothers to stop smoking, which is very difficult, especially when they are taking too much, you can say, when they take too much cigarettes per day, especially 10, 20 and 30 per day, and especially there is very high mortality with and morbidity with these smoking, especially in UK, which is more than 30%, which is too much a number. And so all these complications can be reduced by reducing and cessation of the smoking. For this, strong motivation is needed. That it is a habitual forming and with psychological dependence. So motivate the patient, counsel the patient, and give awareness of all these prevailing complications in the first, second, third trimester at the time of delivery, and then later on postpartum as well. So we try to motivate. We have to have had groups and have group therapy tasks and group therapy setups, and then one-to-one individual counseling is needed, and then there are specially smoking cessation nurses which are dedicated especially for this task, and then one-to-one meeting of all these staff and group specific all these group specific therapies are done, one-to-one session with the special smoking nurses done, and so that the mothers are motivated, empowered, and given awareness to reduce or at least and then completely stop smoking. For this, they can the nicotine replacement therapy is applied, in which these nicotine patches are applied, and it is recommended that these patches, in order to have a less exposure, they should be removed at night at least, and morning they wear these nicotine patches. But first they have to be motivated, counseled, and then we have to have the after when the woman is becoming when the woman is counseled, and the group task and the other support groups and information leaflets are provided to help the women in reaching this decision of reduction of the smoking and cessation of the smoking. And all these measure group specific therapies, group specific tasks, individual one-to-one counseling with the specialized smoking nurses. This empower the woman to decide to reduce the smoking and to cessation of the smoking. And when they completely stop the smoking, then carbon monoxide test is done to check the whether it is successful or not. And also, as I told you, that it increases smoking, not only increases all the complications in intrapartum and postpartum as well. In the postpartum, pregnant induced hypertension, preeclampsia, and eclampsia. And then as I have told you, that it increases also the early neonatal deaths and also the sudden infant death syndrome because of the smoking. And those children which are low birth weight and growth restricted child, they are then in the later neonatal life have behavior problems, have other adaptive difficulties in learning. IQ levels are there low, and they have they have prone to those respiratory problems, respiratory infections and pneumonias and all those. And also they are psychologically, and they are not uh, physically also difficult for them to cope up with the growing children activities. So we'll review with another one. We must try to counsel the women. It's a high for this high risk pregnancy leading to low birth weight, growth restricted IUGR babies, and also leading to reduction in the all. And if they are motivated and they become empowered and they quit smoking, all these complications can be stopped. So we'll review another view. Takeaway message is pray, praise, trust, love God Almighty Allah, and follow Asuasna, the lifestyle of Hazrat Prophet Muhammad Sallallahu Alaihi Wasallam, our health and survival. And we must not forget our glorious past. दुनीम इनकी ठोकर से सहरा और दरिया, सिमट कर पहाड़ इनकी हैबत से राय, दहर में इसमें मोहम्मद से उजाला कर दे. Allahumma ajirna minan nar. O God, save us from the fire of Jahannam. And also Hasbunallah wa ni'mal wakil wa ni'mal mawla wa ni'mal nasir. Waqfa billahi waliya wa kufa billahi nasira. Mother Child Survival Group of Pakistan giving awareness for these in a simple language to reduce the maternal and neonatal morbidity and mortality. And for this, smoking and pregnancy topic is a very important topic. Inshallah, we'll see you. Thank you very much. Wama alayna illa al balagh.